A new UNAIDS report shows that for the first time since 2003, the number of new HIV infections amongst children aged 0 to 14 has not fallen year on year in sub-Saharan Africa. New cases may even have risen slightly, according to this report. Non-profit organization Mothers to Mothers has participated in a high-level meeting on HIV/AIDS in New York. The organization employs women living with HIV as frontline health workers who deliver services and education to those living with HIV and to help prevent new infections. To discuss the new UNAIDS report, we're joined by Frank Bradley de Palomo, President of and CEO of the non-governmental organization Mothers to Mothers. A very good day, and thank you so much for making the time to speak to us. According to this report, how dire is the situation of the number of children with HIV not dropping?
Well, the numbers, because they hadn't dropped for the first time in quite some time, it definitely is something that we need to be very concerned about. But the news is not all bad across the board. When we really look at the data that UNAIDS has released recently, the number of AIDS-related deaths has fallen by 43% across all groups in the last decade. But when we really think about children, and when we think about the fact that 160,000 children aged 0 to 14 newly acquired HIV in 2020, which was the same number as 2019, that means that we're seeing some large numbers. In sub-Saharan Africa, 130,000 new infections were reported among children in 2020, and this means that we're actually having babies that are born with HIV or they're becoming infected during breastfeeding. And the tragedy is that this is completely preventable. We can stop almost all of these infections.
Reasons attributed to this rise in numbers?
Well, I would say that COVID definitely is one of the big issues. So the lockdowns that have both prevented clients from going into facilities, have stopped organizations such as Mothers to Mothers from being able to reach out and to provide services to individuals. But also, we know that COVID-19 has an effect on individuals with unsuppressed HIV. And so there's definitely something going on in terms of individuals which either are at higher risk or because COVID is just really pulling up all the resources and individuals aren't able to make it to clinics, they're not able to get their refills for their antiretroviral therapy or other health needs. And these are most likely the reasons that we've seen this happen over this last year and a half.
Tell us about your organization's contribution to the UN meeting this week.
Yes, so as an organization, we're actually part of the delegation, and we're very excited to be an African NGO that is able to participate in this space. We have provided from the floor information. We participated in the event as well as side events, and we're very excited because out of this high-level meeting, which these meetings don't happen all that often, the last one that focused on HIV/AIDS was in 2016, there is a document, there is a statement that has come out that is extremely positive, and for us, we're excited about three key areas. The first is that it highlights how solutions like Mothers to Mothers, programs that are delivered by communities, for communities, are essential and sets a target to prioritize them. Secondly, the document also highlights that we can't end the AIDS pandemic unless we target the inequalities that make certain groups more vulnerable. That means getting more serious about gender and race inequality and putting an end to stigma around people living with HIV and those who identify as LGBTQI. And third, it recommits to eliminating vertical transmission of HIV infections, which is from mother to child, and ending pediatric AIDS by 2025, which is just in 4 years.
Just tell us about the work that Mothers to Mothers is doing on the ground to avert this situation.
Yes, so Mothers to Mothers, we started out right here in Cape Town at Groote Hospital, and what we found was that there were medications, we had the ability to be able to provide treatment to pregnant women, but there wasn't time. And oftentimes there wasn't the language or the culture to be able to put a woman who was HIV positive coming in so excited about being pregnant, finding out that she's positive and really feeling like her world was ending. So what we did was we trained some of these women that had completed treatment of what's called PMTCT, prevention of mother-to-child transmission. They completed treatment and they had babies that were born HIV negative. We trained these women as frontline health workers that we call mentor mothers. We employ them, and they basically walk on a path with that client from the moment they are diagnosed until that child is about 18 months old. During this time, we help women initiate onto treatment. We help them understand how to disclose to their partners, to their families. We help them understand what other health issues they might be dealing with. We also support them through exclusive breastfeeding or exclusive formula feeding for the first months of that baby's life. And what we've been able to accomplish is, in our almost 20 years, we now work across 10 sub-Saharan African countries. We've employed about 1,800 women living with HIV. Currently, we employ 1,800 women living with HIV as frontline workers. We've reached almost 12 million individuals across these years. And for the last 6 years in a row, we have achieved what is called virtual elimination of mother-to-child transmission, which means that according to the UNAIDS, we have a transmission rate among our cohort that is less than 5%. And so for mothers to mothers to have reached more than 11.5 million women, we've actually saved a lot of lives and created a lot of hope.
We're having a conversation with mothers to mothers regarding new statistics in relation to HIV/AIDS infections. But let's just talk to the live footage that we're showing on the side. The President of France, Emmanuel Macron, arriving at that UK venue for this weekend's G7 summit. Leaders gathering representing members Britain, France, Germany, the US, Italy, Japan and Canada, and as you've just heard, South Africa and India also being members. But Frank, just a last one for you. Everyone is a bit confused at the moment, especially when the HIV/AIDS conversation was still so topical, and we now have to deal with COVID-19. Are the two conversations exclusive of each other, or can we find a way to still prioritize both?
So I think it's a great question. Thank you. HIV/AIDS was really the big first pandemic that not only affected all of Africa, but affected the world. And now COVID, which is here, and the way that COVID really came upon us, in many ways, it shadowed what we experienced with HIV/AIDS. The two are not separate. We need to think about how to connect them, because at the bottom or at the base of all of these issues is access to healthcare, cost-effective healthcare, and effective treatments. And what we found with COVID is we're lucky to have vaccines that work. A lot of that research came from a lot of research that came on HIV. We don't yet have treatments that are effective at the point of infection. For HIV, we have effective treatments that act almost as a vaccine, but we don't have a vaccine. At the base, if we had universal health coverage, if individuals had access to doctors, they had access to cost-effective and even free treatment, we would be in a situation in which neither of these epidemics would have had the human impact and the toll. In 40 years of HIV, we've had almost 35 million deaths, and we don't want to see that with COVID. So we cannot let the two of them be siloed discussions. We have to talk about them as holistic health issues that affect people on the ground.
Let's thank you so much for your time today.
Thank you so much.
And Frank Bradley there from Mothers to Mothers. On to this.